Good afternoon, everybody. My name is Steve Leifman. I am a judge here in Miami-Dade County, Florida. I want to thank all of you for joining this incredibly and critically important webinar. We are extremely fortunate today to have two phenomenal experts to talk to us about COVID and ways to help protect ourselves and to protect our community. And so what I'd like to do is first introduce Dr. Peter Page. He is the Chief Physician Executive and Chief Clinical Officer at Jackson Health Systems, not only one of our nation's largest public health systems, but also one of our best. Dr. Page has been one of the clinical leaders guiding Jackson through the pandemic, helping develop protocols for our system based on guidance from the CDC and evidence-based practices. And on her first day last November, Mayor Daniela Levine Cava appointed Dr. Page to actually serve as the county's first chief medical officer. He has been a trusted advisor for the mayor ever since. He is a physician by training. He has decades of experience with emergency management and emergency and disaster response, which clearly this is, and we are very fortunate to have Dr. Page with us. I also want to welcome Dr. Carol Biggs. Dr. Biggs is the Chief Nursing Executive at Jackson Health Systems as well. She provides leadership to plan, direct, execute, and evaluate strategic and operational priorities to ensure quality nursing practices, continuous improvement, consistent standards and policies that are in accordance with the health system's vision and mission. Dr. Biggs and Dr. Page work very closely to ensure best practices and patient care are delivered in an integrated manner throughout the organization. And I would really like to welcome both of you here today. And so before we get into some questions, I wanted to ask each of you is, what would you tell a family member that might be hesitant to take the vaccine, and any advice that you might be, you should give?
Dr. Biggs, I'll let you start off.
Okay.
Right?
Yeah, I'll go ahead and get started. Thank you, Dr. Page. Well, I'm going to tell you what I actually tell my family members and continue is that, one, I made sure that I got vaccinated because, you have to be the example. Plus, I love myself and I wanted to make sure that I do everything possible to protect myself. And then I made sure that my husband got vaccinated, my children, my mother, because what I'm saying to you is I want to do everything possible to save your life. This is, it's still a novel virus to us, something that just showed up, well, here in Dade County for us, 2020 March. And it, ran its course. And all of last year, we were praying for a vaccine. So we were, teaching everyone, as we still are, protect yourself, wear your mask, wash your hands, socially distance. We went through all of that, of the lockdown, the shutdown, and when things started to get better, we opened back up. And lo and behold, here we are again this year, worse than we were at our worst last year. So it's important that all of our family members and all of us are family. We live in this world together. Protect ourselves for our family, for our immediate family, for the community we live in, and for ourselves. The best thing we have to do that is this vaccine. At this point now, this vaccine now, if you look at from the trials through now, it's way over 2 years old. So and now we have FDA approval on top of that. So even for me, it's approved for children 12 years and up. All of my kids and grandkids who are at that age, I have a grandchild that just turned 12 on the 1st of September. I have an appointment for her. We've been waiting because with school opening back up, we were all nervous, like, oh, she's not protected. School started back up. So it is a safe vaccine. I love myself. I wouldn't take it or ask my mother to take it if I didn't think it was. So please, everyone that's on this call, any questions you have, for anything that's preventing you from getting the vaccine, please don't leave this call today without getting your questions answered. Thank you.
Thank you, Dr. Biggs. Dr. Page, would you like to give us an opening statement?
Sure. I echo a lot, obviously, of what Dr. Biggs referenced. I think we have to be examples in our families, in our communities, in our occupations, in our workplaces. I'd like to jump into a couple other areas. As Dr. Biggs mentioned, this is a very safe vaccine. There's been over 176 million people fully vaccinated in the United States, and we hear very little about adverse side effects or adverse events. That's an extraordinary number of people who are fully vaccinated. So you really have to, we all know a lot of people who've gotten vaccinated, they've done very well, but when you look at that number is astounding. So I think that reinforces the fact that these are very safe vaccines. Another thing I'd say is that they're very effective. These vaccines, even with the Delta variant, the latest variant, are showing to be over 90% effective against preventing severe disease, hospitalizations, and death. That's phenomenal performance for a vaccine. Some of this is unheard of territory for us with vaccines. So knowing that they're so safe and so effective is really reassuring when you're making a consideration of whether or not to get it. I think we all need to understand and realize the point. This is our chance to end the pandemic. Our number one shot, so to speak, is to get vaccinated. We need to get enough people vaccinated to start turning the corner on the pandemic, ending the emergence of new variants, and getting us back to a more normal, situation as we had previously. And I think, as Dr. Biggs referenced, this is not just about you as an individual. It's about people in your family, friends, colleagues, people in the community. All these people are counting on you to do your part to help end this pandemic. So it's a big responsibility, but it's one we take seriously, and we have to look within ourselves to try to find, that decision-making effort to really make the right decision and get vaccinated. I would add that we in the healthcare arena obviously see too much of the outcome of this virus. The devastating illness is tragic. And what healthcare workers are going through on a day-to-day basis is just, almost unbelievable. And I emphasize that so that people realize there are long-term consequences to making some of these decisions, and that the most appropriate decision, obviously, at this point is to get vaccinated.
And thank you both for that. And, I speak to a lot of people every day, and there's so much unfortunate misinformation, particularly through social media, about some of these issues that I thought some people are afraid to take the vaccine for whatever perceived risk that they think might affect them. But maybe you could talk about the risk of not taking it and the complications of getting the virus versus any risk of getting any kind of side effect from the actual vaccine.
I would start off with, as we see across the country and across the world, in the United States right now, and at Jackson across our health system, 90+% of the people that are being hospitalized currently that have COVID are unvaccinated. That's a pretty amazing number. That speaks volumes to the significance of not being vaccinated in the face of this illness. I think the other thing to remember is that of the remaining 10% or so, a significant number of those are immunocompromised patients, transplant patients, patients on immunosuppressive medication. And so the vaccines are very, very effective at preventing, the development of severe disease. What we see on a daily basis is catastrophic. We're seeing more young people. We're seeing people with, really no past medical history, who are unvaccinated, who are catching this virus, who are having devastating outcomes, are dying. And it's not just in South Florida or Florida, it's across the country and across the world. This is really something that, is preventable largely at this point, and we're just not taking advantage of that opportunity. I'll let Dr. Biggs follow me on that if she'd like.
Yeah, it really is. It's really so disheartening. And it's really painful as a healthcare provider to watch, as what Dr. Page just described, a healthy 20-year-old, a healthy 43-year-old with no pre-existing conditions, sitting in the unit on a ventilator and going in the wrong direction. And with all of the, we're a quaternary care facility at Jackson. We can treat any and everything. And we still have to watch these young people with everything being done, everything that could be done, being done. And we still can't save them because the virus took over their body and all their functions. It is so disheartening and so overwhelming. Some of our providers, our nurses, our physicians, literally do have PTSD from going through this now for almost 18 months or more, and to know that it is potentially preventable. It is 95% preventable with the vaccine. I got a news 2 days ago that totally blew me away. A family that, my kids grew up with their kids, they moved away to North Florida, probably about 5 years ago. I got word that the father died from what? COVID. He wasn't vaccinated. And his kids are saying he kept promising them he was going to do it. He went through the whole hospitalization, was intubated on the ventilator, got off the ventilator, was getting ready to go home, had a small blood clot, went through to his lungs. He went just like that. I'm still not really, I haven't wrapped my head around it yet because I'm still picturing him. And to just know one simple vaccine would have, this did not have to happen. So it's, it is so devastating. And Dr. Page, if you could talk a little bit about even the patients who have COVID and recover, and with the long COVID and all the other.
Yeah, thank you. I was going to ask that because what I hear from people sometimes is, hey, it's like the flu. Once I get over it, I'm fine. But I know from reading that it causes tens of thousands of blood clots in you. And if you may not die from the actual illness, but you may get it from a blood clot or have a stroke or have some really serious long-term illness, your lungs are permanently compromised. And people don't understand that this just doesn't go away if you get it for a lot of people. So maybe Dr. Page, if you could follow up on that.
Yeah, it's a great point. I did want to make a follow-up comment to Dr. Briggs's comments. I can't tell you how many times we've heard patients that are in extremis who are not vaccinated, who say, on their deathbed, I wish I had gotten vaccinated. And it resonates with not just with the staff, but with the family as well. So very important point. The long hauler syndrome or the post-COVID syndrome or long COVID syndrome has a lot of different names. It really relates to long-term sequelae of just getting the infection itself. So these people essentially recover from the acute illness. And then at some point down the line, it might be a month, it might be 6 months, it might be a few weeks, they start developing symptoms attributable to certain parts of their body. Some of the classic ones we hear about obviously are related to the lungs, difficulty breathing, shortness of breath, recurrent infections in the lungs. But there's a lot more than that people are experiencing, as you alluded to, blood clots, but also even psychiatric illness, even neurologic syndromes. And so what we're seeing interestingly is that the infection can actually cause a lot more long-term complications than the vaccine. There was a recent study done comparing the vaccine to actually having the COVID infection. And it actually showed that having the infection puts you at a much higher risk of having adverse events than the vaccines in a lot of the categories that the vaccine's been blamed for. And so when you weigh having the infection versus having the vaccine, it's not even a fair comparison. But I think that the other thing to remember is that we still don't know the long-term sequelae because it's been such a short time frame for this infection. What we're seeing is real, and there are long-term sequelae for a lot of people who go through the infection. But we still think that we don't know how long it's going to go on for. We don't know how much more complicated it's going to get. We don't know how much these variants are going to change the long syndrome. So, the risk is definitely far beyond just the acute hospitalization time frame, if you are fortunate enough to survive.
Yeah, I mean, people think, oh, if I don't end up in a hospital, I'm fine. And it's really not the case. In fact, I just read this week that one of the longer haul side effects may be fibromyalgia, that for your rest of your life. I mean, and there are no, you tell us, but from what I'm reading, there are no type of side effects from the vaccine itself compared to, these horrible side effects from the illness.
And I'll tell you what scares me, as it continues to scare me, is there's a lot we don't know about the virus and about the infection.
Yeah.
And it seems like we find out new things about the infection almost on a daily or a weekly basis. So, it just reinforces the fact that, the obvious option, the best option is to get vaccinated.
I've got a list of questions I want to go through, and some questions are coming in, but I recently read a study, and it wasn't to COVID specifically, it was on pandemics and schizophrenia. And they found that women who are pregnant in the first trimester that have a virus from a pandemic, the offspring have a 7 times greater chance or likelihood that the child would develop schizophrenia. And in the second trimester, a 3 to 5 times greater chance that the child will develop some type of very serious mental health issue later on in life. And so I guess one of the questions I wanted to ask, I think Dr. Biggs might be able to answer this, or Dr. Page, about is it safe for women who are pregnant to get the vaccine? And if they're nursing, is there any problems with getting the vaccine?
So yeah, I can start off with that. Currently at this time, all the studies that's been done and all the women who have gone through the trials. So for, the 2 years of clinical trials that were happening, some of the women who went through the clinical trials have since had healthy normal babies. Also, there's a registry, a V-Safe registry that have at the time of when this publication was written, 2,500 pregnant women who were vaccinated and were registered. And again, no issues with the pregnancy, no problems with miscarriage of delivering normal, healthy babies. The flip side of that is that we have had quite a number of women who have contracted COVID while they were pregnant. And it's been some devastating outcomes, miscarriages. On some babies have been stillborn or died shortly after. Some of the mothers, unfortunately, did not make it. Some have ended up on the ventilator. Really, it seems like it seems like with the COVID, just from anecdotally and things that I've read and what I've seen, that the pregnancy becomes a pre-existing condition when they get COVID and pregnant. So it really ravishes the body. And as we just talked about, even those who have not had to been hospitalized and gone through that, again, we don't know what that will mean to them or to the child later on down the road, having gone through COVID. So when you really do the risk benefit, they're, hands down, getting the vaccine is proven to be safe with no negative outcomes. And again, getting COVID has really been devastating.
We have a couple questions that came in. I've got several others, but let me try to ask the questions for the people that are actually participating so I can make sure I get those. But thank you for that information. One viewer is asking, should we take the booster, and how long after the second vaccine should we wait? And do we need a booster if we have the antibodies?
So I'm happy to respond to that one, Judge. The big question about boosters really relates to the time frame from your vaccinations. you've seen that there's been an approval for emergency use authorization for a third dose in people with immunocompromised conditions. It's not really considered a booster because it's more to help them form an immune response that will help fight off the virus, because initially they may not form the same immune response that everybody else does. And so that's already in place for both Pfizer and Moderna. Now, for the third booster shot that everybody's looking for now for the rest of the population, currently it's undergoing review by the FDA, and it will be discussed at a meeting on the 17th of this month, and hopefully will be approved. It sounds like Pfizer's booster may be approved ahead of Moderna's. It's all based on submission from data from clinical trials. And so once that's approved, the expectation is it's going to be either 6 or 8 months after your second dose. The initial discussion was about 8 months. Some are saying 6 months might be enough. I can't really commit to which one they'll choose, but it'll probably be one of those two. And really, it's based on data that they've obtained as it relates to your immunity over the course of time after you get vaccinated. It's natural that your immunity can decrease depending on how long it's been since your completed vaccination. The other thing is that there are certain populations that are in higher risk categories that may not be immunocompromised, but may have higher risk of having lower immunity or immunity that gets weaker sooner. And those tend to be, people over 65, people in long-term care facilities. Also, a lot of people are looking at people with significant underlying conditions. And so I think, so my recommendation obviously is when you get an opportunity to get the booster, get the booster. I think that there's no question about that, to boost your immune system, to make yourself stronger in preventing acquiring this infection. But I think that we still have to see how some of the details work out towards the latter part of the month based on the information that the FDA and the CDC's subcommittee are reviewing.
If I can follow up a little bit, because there's 2 questions in that. So right now, people are getting quote unquote booster. It's really just a third shot, correct? It's the same dosage, same makeup of what they would have received in their first 2, correct?
Correct. And it's because the theory is that they didn't form a strong enough response initially because of their immune suppressed condition.
So are the companies now working on an actual booster or a slightly different formula that will take into account the new variants a little bit better? And if so, should people wait for a changed booster that's more on target for the new variants?
So it's a great question. My understanding is that the companies are working, especially the messenger RNA vaccines, where they can kind of re-engineer them to be more focused on a specific variant or variant path. The problem is that we don't know how long it's going to take, and it's going to have to go through some kind of an approval process as a re-engineered vaccine. And so the proposal right now for the third dose is still the dose that you got from your original vaccine. It's just an extra dose. And that's what the expectation is for Pfizer at this point, so that people can get the booster sooner. With Moderna, they're still going through some of the information to decide if it's going to be the same dose or a slightly decreased dose as the booster, depending on what their clinical trials are showing. So it's a great question. I would love to get, a re-engineered messenger RNA vaccine that goes after specific variants, especially this Delta one. It's just not ready yet. And it's not going to be ready. It's unpredictable when it will be ready.
Well, I guess one of the ironies is because so many people are unvaccinated, they're actually allowing newer variants to come in that we may not be able to stay ahead of with whatever the next booster is, because it's going to look for a new host and it's going to keep evolving into a different variant. Is that true?
Judge, thank you so much for saying that. Yes, 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 yes. We as humans are allowing this vaccine to use our bodies to wreak havoc and then change itself and jump into another person that allows that virus to use its body. Do not allow yourself to be used by this virus. This is what's going on. The virus cannot live outside of the human body. So if you don't allow this virus into your body, it cannot continue to mutate. And that's another piece of this. Right now, what is it, Dr. Page? 95, 97% of all the infections are the Delta variant. So, right, something like that?
Yeah, 97% was the sequencing we did down here between Jackson and University of Miami. The latest CDC data has at 92% in Florida are the Delta variant.
So that means pretty much that initial variant from last year is pretty much gone. So had 80% or so of us been vaccinated, we would not be having this conversation right now. And for all of us, and all of you all on the call as well, who want to have some semblance of normalcy in our lives, if we don't take responsibility and not allow this virus to use our bodies, it's going to continue to mutate, because that's what viruses do. They mutate.
So I got a question that's sort of a follow-up to what Dr. Page just said and Dr. Biggs just said, and it goes to a little bit of the skepticism that people have. So maybe you can answer this question. It says Israel has the highest percentage of vaccinated individuals, and still they have a peak in COVID cases. They also did a study which shows that people that contracted the virus have 13% more antibodies than someone that isn't vaccinated. I'm vaccinated, but I still believe it should be offered, and everyone should make the choice individually.
It's an interesting topic. I will tell you, there's a lot of data out there from different trials and studies that has shown that the immunity from the vaccines is stronger, lasts longer than the immunity from the infection. And I think that, one of the numbers I talk about, unvaccinated people who have had the infection versus vaccinated people who have had the infection have about a 2.3 times greater risk of reinfection. So when you think about that, these are people who have had the infection. Some of them got vaccinated after the infection, some didn't. And the risk of getting the infection again was 2.3 times higher in the people who were unvaccinated.
Let me make that clear so no one gets confused. So if you get the virus and you don't get vaccinated, you have 2 to 3 times greater chance of getting the virus again if you remain unvaccinated.
Correct.
Than someone that gets vaccinated.
Yes, that was a recent study that was just reported out in the literature.
And if you get it a second time and you've not been vaccinated, does it come back stronger, weaker, or about the same, or do we know?
Well, we've seen it come back as aggressive as it was, and sometimes stronger than it was the first time. I haven't seen data that really supports that as far as how often it happens and whether or not, 50% of the time it's worse, better, the same. The concern is that the vaccines do help, decrease the risk of acquiring the infection, acquiring the reinfection. And it's been shown, in a lot of places that the immunity from a natural infection, they say it lasts about 90 days, plus or minus. That number is a little bit ambiguous, but that's why, if you recall way back when people had the COVID infection, that was recommended that they wait 90 days before they got vaccinated, because the theory was that they had 90 days of protection. But we are seeing it, we're seeing it now in vaccinated people, and some of the people that got vaccinated early on, that their antibody levels are dropping. And so, there's a lot of research going on. This is still relatively new. We have to remember that this all started last year. And so we're going to learn more and more about it, but we have to try to make the decisions based on the preponderance of evidence that we see. And that's really what we're seeing now, is that the vaccines provide more long-term immunity than the natural infection.
So would one of the reasons be that people have a 2 to 3 greater chance of getting reinfected without the vaccine, because a different variant may hit them the second time, and without the vaccine, they don't have really they may have some immunity, but they may not have as much protection against the variant that was different in what they had originally?
I think that's a very reasonable conclusion to draw. I think that's probably a contributing factor. The vaccines have, kind of produce a more broad immune response, based on the engineering methodology of messenger RNA that they use. But, it's probably also that, the natural immunity wears off sooner. And so people who've gotten the vaccine on top of the natural infection have a higher level of immunity. And so it probably increases their protection against not just the original, but also to a certain extent, the variants.
All right. I have a couple more questions from people watching, and I do appreciate your questions. Let's see, it says, although not FDA requirements, the Pfizer company has committed to additional post-marketing safety studies, including conducting a pregnancy registry, which you mentioned, study to evaluate pregnancy and infant outcomes after receipt of comorbidity during pregnancy. If it's safe for pregnancy, then why are they having to conduct these studies? Also, what about the people who have died from receiving the vaccine? Can they discuss the underlying medical conditions that would indicate that it is unwise for persons with certain conditions to take the vaccine, such as a fatty liver?
The first part of the question, what was the first part?
The first part is basically they're asking if it's so safe for pregnant women, why is the FDA requiring them to study pregnant women that get the vaccine and the newborn?
So if you think about it, usually whenever we do any research study in medications and devices, we usually do not do research study with pregnant people. Normally pregnant women that's normally an exclusion, right? So, but with this virus, now we're having the registry. So I guess there are research trials being started now with pregnancy, but we have to look at it so we can have the sound scientific data. Now what we have is we have the retrospective studies and prospective studies being done, looking at people, again, women who were in the study who were not pregnant at the time, with Moderna, Pfizer, and Johnson & Johnson from 2 years ago, over 2 years ago, has since had healthy pregnancies, healthy babies. So those are documented. And now we have the registry so we can keep track to make sure that it's consistent. Again, with when Johnson & Johnson had the issue, I think earlier in the year, with the, what was it? Was it the blood clot issue? The issue that we had with Johnson & Johnson.
Yeah, the thrombosis in the cavernous sinus.
Right. It was, it came out to be about six people that had issue. One died, but that developed this out of millions. So when you look at it, when you really, really look at it, women who take birth control pills, the chances of having that is so much greater than what the results were from this study. So we have to keep everything in context. And unfortunately, a lot of the social media platforms will jump on one thing and just focus on that one thing and take it out of context. But we have to look at things scientifically and keep it in the context it belongs in. So yes, this has shown to be safe in pregnancy and women who want to become pregnant, and the data is there. But we have to continue to keep track. That's the only prudent thing to do as scientists.
Let's get into some of these other questions, because I think this gets to some of the heart of the problem for some people. One of the question goes on and asks about people that may have died as a result of the vaccine. And nobody wants to be that one person, even if it's 1 out of a million. But compared to what could happen to you if you don't get vaccinated, it seems to me so extreme that the risk is so minimal that it's not worth really taking. And do we know, and I guess the follow-up question that was asked, that if either doctor can answer, are there certain conditions that people should be aware of that would put them at a higher risk of an adverse reaction to the vaccine?
I think you raise a great point. Whenever we analyze these kind of situations, especially in something that's so new as this pandemic is with this virus, it's all about risk benefit. And when you look at the side effect and adverse event profile and the deaths that have occurred, in people who have been vaccinated, there's a lot of ambiguity in the information that's coming out. A, it's very rare, very infrequent based on the number of people who've been vaccinated. But B, even when you look at some of the deaths, and these deaths are reviewed pretty aggressively by the CDC, oftentimes they believe it has nothing to do with the vaccine.
Right, they just had another natural cause, heart attack,
Right.
cancer, right, and they just coincidentally had the vaccine. But I don't know if there's any actual studies that says that they can point to and say someone's actually died as a result of taking the vaccine.
And I think that's an important point to reinforce, because that's part of what Dr. Biggs referred to. A lot of the social media platforms, try to exploit some of this information without necessarily knowing a lot of the details or investigatory findings related to the case. And so I think that still in the grand scheme of things, over 176 million people fully vaccinated in the United States, that's a huge number. And we hear very little about adverse outcomes. And when you talk about people with underlying problems, the big contraindication to the vaccines obviously is anaphylaxis or a severe allergic reaction to a component of the vaccine. Outside of that, when you talk about people with heart disease, lung disease, neurologic disease, they're at an increased risk of getting COVID and of having a bad outcome from the infection, much more so than from the vaccine. So it's all this risk benefit stuff that greatly weighs on the side of the benefit from the vaccine.
Yeah, Dr. Biggs mentioned, if you take birth control pills, you have a 1 out of 100 chance of getting a blood clot. There's nothing even close to that kind of danger with the vaccines. Yep. And so I just, and people aren't stopping taking birth controls. It's pretty amazing. So no, I won't make a joke about sex then. I don't think that would help. But I still think, people need to look at this a little bit more responsibly and not just worry about that 1 out of 15, 20, 30 million adverse reactions that could possibly affect, because we know that if you don't get it and you get COVID, there are going to be some serious reactions that we can almost guarantee. And that does point to one other question I'd like either of you to address that I think people also fail to understand. Our emergency rooms are full. And so, God forbid you have a heart attack, a car accident, slip and fall. They're talking about rationing now of medical services because the emergency rooms and the ICUs are getting full. So maybe you can talk to people and let them know the impact it's having on the system itself. And is the system built, is there enough capacity in our system to handle the normal stuff that you all see plus this?
That really is such a very good question. I'm so glad you brought it up, because it is really not just with us here in Dade County, but all over the United States right now. Every place where we have a spike and a hot spot, the healthcare system is just totally devastated. There's a group in I think in Palm Beach somewhere, a group of physicians it was really just to make a point. They did like a stage walkout just for like 15 minutes, just to try for the community to understand the pressure that they're under in order to provide care to in the emergency room. There's a hospital in California where the ambulances were literally parked outside they were treating them in the ambulance because there literally was no room in that emergency room to bring them in. So, we have been to the brink where we, within South Florida, us hospitals are calling other hospitals. This is what, we have going on. Can you help us? I got a call Sunday rather, from a CEO I used to work with asking, can Jackson help our hospital? Every hospital is devastated right now in trying to provide care to the COVID patients and the non-COVID patients. We have non-COVID patients waiting for beds. When you think about it, if a hospital is on bypass because their ER is full, you have a non-COVID patient, a regular person having a heart attack. If that ambulance have to bypass one hospital to go to another, guess what happened to the chances of that person in that ambulance? They lose every minute that pass, right? Whether it's a heart attack or stroke. So the impact of this disease on the hospital is way beyond COVID itself. It's totally taken us to a place, we have never been. And our healthcare providers are so exhausted. So many healthcare providers during the season have actually left the profession. They just can't do it anymore. People are retiring early. So I mean, the impact that this is having, it's way beyond just, will I take the vaccine or not? Me not taking the vaccine has such ramifications for our healthcare system and our community and our ability to provide care for the COVID and the non-COVID. So it's really a plea. I'm saying all that as a plea to everyone. Please, please, please get
Well,
vaccinated.
and maybe if you could follow up on that, the other part of it is not only the emergencies, but all the elective procedures have been postponed. So if you're going in for a cancer screening or an endoscopy and you may have some real serious issues, that's going to get put off. And now your health care is going to get delayed. That may be critical down the road if you don't take care of it now.
This is very true. All hospitals, again, across the US that have had spike have had to put surgeries on hold where we're only doing urgent and emergent. So true, something that's elective, and just because it's elective does not mean it does not need to be done. It's just that you can come in Monday or Tuesday. That's usually what that means, but you need to get it done. And the physician is not able because we're not able to book the OR because we won't have space on the floors to put you after. So absolutely, this is one where we do have to be our brother's keeper, and getting the vaccine, while it may seem like it's a personal choice, the ramifications of you not getting it is really not a personal choice.
So let me go to a couple more questions. These both are combined. One is, why are vaccinated people getting the Delta variant? And the other is, vaccinated individuals can still get the virus and spread it without knowing it. Why is it that no one can sue the pharmaceuticals in case someone dies or has an adverse reaction from receiving the vaccine? If it's as safe as they claim, why can't they be held liable?
I think that the big point to be made is that none of these vaccines are 100% efficacious. So efficacious really just means that they stop you from getting the virus. The vaccine's role is really to decrease your risk of having severe disease, hospitalization, or death. And so when you hear about these vaccines, when they came out being marketed as 95% efficacious, that's in stopping you from getting the virus at all. That's a phenomenal number, but even at that number, there's still 5% of the population that are going to be at risk of getting it. Now, as you go through the vaccination process and variants come out and some of your immunity wears down and it's a new variant, you're still going to have a risk of getting the virus. It's just that you hope that the vaccines keep the symptoms and the severity of the disease under control so you don't get real sick and you don't end up being in a hospital or dying. So when you think about a vaccine, these vaccines have been so high performing over the course of the past several months. It's really amazing. But they don't necessarily in all people prevent you from getting the virus. What they do is they cause a lot of people to get, if symptoms, very mild symptoms. And when you are carrying the virus in an acute infection, you can still transmit it. So even vaccinated people can transmit, especially this Delta variant. but the goal of the vaccine, and that's why we recommend, and the CDC continues to recommend, we take the appropriate precautions in the community. If you're in a high transmission area and you're indoors in a public setting, wear a mask, even if you're vaccinated, because there is still a risk that you could have it, could be transmitting it, or you could acquire it from somebody else and then pass it on. So, you know, you just have to understand that vaccines are really to help save you from the severe illness.
You know, one of our viewers who has been vaccinated, so sir, I thank you very, very much for doing that. I think you're being extraordinarily responsible. But he goes on and he still thinks it should be someone's choice, just like it is someone's choice to drink or smoke or maintain unhealthy weight. I would add in as a judge a little different perspective on that. You know, this to me has a lot less to do with someone that smokes or drinks or maintains unhealthy weight. This is more akin to somebody deciding to run a red light. And you can't do that, it's not legal. But the reason it's not legal is because you're either going to get killed, kill somebody else, get hurt, or hurt somebody else. We're not allowed, if we know that this virus can kill somebody, we're not allowed to go out and shoot somebody. Why should we be allowed to go out and breathe in their face and give them an infection that might kill them? And so I think people have gotten really confused on what freedom really is, because the people that are vaccinated want to see this over just as bad as the unvaccinated people. And we can't get there unless people, all of us, step up and start to do the right thing. Heck, I get a flu vaccine every year. That's only 30 to 50% effective. This is 90 to 95%. And it really helps protect us. So I just hope that people continue to think really hard about this and do what needs to be done. Let me see a couple other questions. What are the differences between the different vaccines and what are their side effects?
Well, the big difference, you know, there's two big categories of vaccines being used in the United States. One is the messenger RNA vaccine, and the other is the essentially dead adenovirus vaccine. The messenger RNA vaccines, these are the first vaccines being utilized in the country that are made with the messenger RNA methodology. But messenger RNA methodology has been studied for 2 or 3 decades on a pretty regular basis. This is the first time it's been used to actually be used in a vaccine that's being used in the country. And the way they work is that, this messenger RNA is injected into your body. It tricks your body into creating a protein. That protein is similar to the protein on the COVID virus. And your body produces the protein and then kills the protein, then kills the messenger RNA, and then builds up antibodies to that protein based on what it learned from the messenger RNA. It's a really safe vaccine. It's not like you can get COVID infection from it. And it works very well, as you alluded to, in preventing severe disease and hospitalizations and death. The adenovirus form, which is the Johnson & Johnson form, is more of a traditional. You take a virus and the virus is deactivated or dead, and then you create a virus that stimulates that protein when it's injected into your body, and then your body reacts to the deactivated virus and produces antibodies to that virus's protein as well. And that's the more traditional, for example, some of the other vaccines that we get and have gotten on a regular basis. Both types are safe. The Johnson & Johnson didn't have the same efficacy rates that the messenger RNA ones did, but the side effects from them are typically very mild, and they're typically soreness at the site, sometimes redness or swelling at the site of the injection. Some people get low-grade fevers, muscle aches, joint aches, sometimes headaches, and sometimes people get tired for a period of time, but they generally resolve within 48 to 72 hours with no long-term sequelae, in the majority of patients.
So a couple interesting questions. Can a 12-year-old take the first vaccine on the same day he or she turns 12, or should they wait a day or two after their birthday, or does it matter?
Well, that,
We're just thrilled they're looking at it that seriously. So
well,
ever,
I can only answer on a personal level. My granddaughter turned 12, and I made the appointment on her birthday. I didn't give her the shot on the birthday, but I made the appointment. So it's a couple of days after. It's
is it going to make a difference one way or the other if it's day of or 2 days later?
I didn't want her to possibly have a sore arm on her birthday. I don't know.
There you go. And then great next follow-up question is, can I get the shot at Jackson Hospital today? Do you guys offer it anymore, or do they have to go to one of the pharmacies?
Yeah, not anymore. We did it for quite a few months. We're quite proud, actually, also of our vaccination stations, and that we were able to mirror our community and vaccinating, in a culturally competent way. But now, because it is so available at every CVS, Publix, Walgreens, and I think the county still have some sites, we no longer offer it for the community, only for our employees.
But you can walk in. Do you even need an appointment at CVS or Walgreens or Publix to get the, okay.
Some Walmarts, yeah.
All right, terrific. All right, let's see if there's some other chat questions. And then we'll give you a few minutes if you have any closing comments you'd like to make. Let me see if I missed anything. We got a lot of questions in the questions and answers. Let's see, are we missing anything here? All righty, let's keep going down. I think they're all pretty similar. Can the doctors explain viral shedding and why the media is referring to vaccinated persons as possible super spreaders?
Go ahead, Dr. Page. I haven't heard about viral.
Well, shedding the virus is normal when you get a viral infection. The issue with the vaccinated population is what we had talked about previously, is that, the vaccines, even being very effective, don't necessarily prevent you from acquiring the virus. What they're designed to do is get your body to protect you from having, significant effects from the virus. And so even if you're asymptomatic, you can be carrying the virus, and you can transmit the virus, but you're not getting sick. That's really the goal of the vaccines. Some people get a runny nose, congestion, cough. This is vaccinated people who at some point later on, run into somebody and get exposed to the virus and get the virus and carry the virus. I think that the big thing to remember is that when you're vaccinated, you carry the virus and shed the virus for a shorter period of time than if you're unvaccinated. And so, you have to be more careful longer than if you were unvaccinated and carrying the virus. So, viral shedding is normal. And the vaccine, as I mentioned previously, is really designed to prevent you from getting real sick. And so there are a certain percentage of the population with any vaccine that are going to get the virus and are going to carry it and spread it. You just hope that. But, in this case, it's much more the unvaccinated that are out there that are spreading it than the vaccinated. So, I think some of that media.
It's almost like we have two pandemics going on, the unvaccinated and the vaccinated, and the unvaccinated are getting much sicker. Not to say that the vaccinated aren't getting the virus, but they're not getting disabled in the way that people are unvaccinated. But I guess it also points to what you said earlier, is I was in New York a few weeks ago, and as I was getting ready to leave, I got a pop-up on my phone from the state of New York asking me if I would like to participate in tracing. And I was like, wow, this is phenomenal. And of course I said yes. And the second I landed back in Miami, it was like I landed in a place where no one thought there was a COVID. No masks, no social distancing. People seem to think just because they've gotten the vaccine that they can return to full normal life at this point. I'm not sure that's the case yet. So talk about some of the precautions we still should be taking, even if we're vaccinated, please.
You know, we talked about the indoor, in public spaces indoors, in high transmission communities, we should all be wearing masks. That's vaccinated, unvaccinated, and that's largely related to not only acquisition, but spreading the virus. I'm a big believer, and I speak about this relatively frequently, you know, large gatherings, indoors or outdoors, are always a risk. And people say, well, if you're outdoors, you don't have the same risk you have as indoors. That's true, but there are a lot of variables. And if you're at a concert, nobody's wearing masks, and you're singing and drinking and eating, you know, that's a high risk environment, especially depending on the capacity of, you know, the venue. So I really try to get people to think about it, be smart, you know, wear their masks, socially distance, you know, obviously keep their hands washed, try to avoid crowds. If you're indoors, try to make sure it's a well ventilated area. And when you can, eat outdoors. You know, we're in South Florida. We're heading into the best time of the year. You know, get outdoors. You know, the concern is that, you know, in the Northeast, they're heading into winter. They're going to go back indoors. And so that's going to put them at a higher risk category. So a lot of it is really just, you know, thinking about it, trying to figure out ways to decrease the risk that you're generating, not only for yourself, but for others. I don't know, Dr. Biggs, if you want to add anything.
No, you pretty much said it all, Dr. Page. We still have to continue the mass social distancing and washing our hands. And I think something I do want to add, with school being opened, I just learned from my grandchildren that some schools are giving the kids a mass break. So they're allowing them to take off their mask for a certain period of time. And I said, indoors? They said yes. I'm like, oh my God. So, you know, so you might be vaccinated, but your grandchild or your children in school. So, you know, please speak to them also. There should be no mask break. Keep on your, you know, keep their mask on, keep your mask on, wash your hands, because this Delta variant is, very, very highly contagious. So, you know, wash your hands, don't touch your face, you know, your mouth or what have you. Just all the common sense things that we did before. Even vaccinated continue to do the same.
Well, first, I want to thank both of you for the amazing service that you provide to our community. I'm sorry that the community isn't responding as well as it needs to, and we are overwhelming your system of care. But please know how much we really greatly appreciate everything that you're doing, not only to save lives, but to really help our community get back on its feet. I think people forget that this is having an enormous impact on our economy. I had to cancel 6 flights this week on trips I had scheduled between now and October all over across the country for work, because all of these meetings are again being canceled or postponed. And so I appreciate everything that you're doing. We've got about 2 minutes left. If you all would like to give us a closing minute, that would be wonderful. But thank you for doing this. We're so appreciative. Dr. Biggs?
Thank you, Judge. And thank you to all of you who did come on to listen to us on behalf of Jackson Health System. I do want to let you know we are here for you, and we do look into our website, keeping you safe at Jackson. That's our website. We have a lot of videos and information, testimonials, so any information you may need. And thank you, and I hope you got your questions answered.
Thank you, Judge, and Dr. Biggs. Always a pleasure to participate in these forums with you. You know, we're here for the community. You know, we want people to hear us. We want to answer questions. We want people to make well-informed decisions and not be led by misinformation that sometimes gets out there in the social media world. And this is what we're committed to. And so any opportunity we get to come out, answer questions, and speak about some of our experiences and some of our knowledge around some of these things, we're more than happy to share them. I do want to thank everybody who participated. It's obviously a positive sign that people have an interest in this and want to learn more about it. But I do encourage you to share the information, with your friends, families, colleagues. It's really us that have to drive this project to try to get more and more people vaccinated in our community. So thank you.
Well, again, thank you both. This session was recorded. So if you know people that you believe would benefit from this session. We will send out a link so people can watch it on their own time if they unfortunately are working and couldn't get to it today. But I cannot thank Dr. Biggs and Dr. Page enough for participating today, and again for your remarkable and phenomenal service to all of us. And look, if you have a question and you're still not sure, call your doctor. They'll talk to you about it, okay? If you think that maybe you have some underlying issue that might be a problem with the vaccine, talk to your doctor. They'll let you know. Well, thank you all very, very much. We wish you the best. We want you to stay healthy. We care deeply about each and every one of you. Please get vaccinated. And if you have any questions, talk to your physician. Thank you all. Stay well. Be well. Take care.